Hello everyone. Today I'll be presenting on achondroplasia, the most common type of dwarfism, and a fascinating example of how a single gene mutation can impact human growth and development. What is achondroplasia? Achondroplasia is a genetic disorder that affects bone growth, especially in the long bones of the arms and legs. People with this condition have a short stature, typically around 4 feet tall, and disproportionate body parts, a normal sized torso with shorter limbs, a larger head, and distinct facial features like a prominent forehead and flattened nasal bridge. Common symptoms include short upper arms and thighs, curved spine, either lordosis or kyphosis, both legs, trident-shaped hands, crowded teeth, and frequent ear infections, delayed motor milestones like walking, which may happen around 18 to 24 months. Despite these physical differences, intelligence and cognitive abilities are usually unaffected. Genetic cause and inheritance. Achondroplasia is caused by mutation in the FGFR3 gene, which codes for the fibroblast growth factor receptor 3 protein. This protein normally regulates bone growth by limiting cartilage formation. But in achondroplasia, the mutation causes FGFR3 to become overactive, slowing bone growth too much. This is a point mutation, specifically a base substitution in nucleotide 1138, where G is replaced by A. This leads to an amino acid change from glycan to arginine at position 380 in the protein called the G38R mutation. Achondroplasia is inherited in an autosomal dominant pattern, meaning just one mutated copy of the gene is enough to cause a disorder. About 80% of cases result from spontaneous mutations, often linked to older paternal age. How common is achondroplasia? Achondroplasia affects about 1 in every 15,000 to 40,000 births, with around 250,000 people living with it worldwide. It affects all genders and ethnicities equally, with no specific group at higher risk. For diagnosis, achondroplasia can be detected prenatally via ultrasound if shorter limbs or a large head are seen, after birth through physical exams, x-rays, and genetic testing for FGFR3, MRI, or CT scans may also be used to check for spinal issues. Genetic testing is especially helpful if one or both parents have achondroplasia, or to distinguish it from other conditions. Treatment options. There is no cure, but several treatments help manage symptoms. Pain relief medications, physical therapy, and occupational therapy can improve mobility and independence. Surgical options like spinal decompression or limb lengthening are sometimes used, though it is controversial. Developmental therapy and speech therapy may also be offered. And support networks like Little People of America provide community and advocacy. Prognosis and current research. Most people with achondroplasia live healthy, fulfilling lives with near normal life expectancy, though slightly reduced, about 10 years shorter on average. Ongoing research is incredibly promising. The most exciting development is vosoritide, created by BioMarin Pharmaceutical. Vosoritide, a daily injection approved in 2021, helps improve bone growth in children. Clinical trials across the US, Europe, and Australia showed that vosoritide can significantly improve growth rates in children. It works by counteracting FGFR3's overactivity, mimicking a natural growth promoting molecule called CNP. To wrap up, achondroplasia is a powerful example of how a small genetic change can have a big impact. But with ongoing treatment and research, people with this condition can thrive. Understanding and acceptance are key, and science progresses, so do the opportunities for a better quality of life. Thanks so much for listening.